Although inflammation is a normal part of the body's immune system, inflammatory responses can be very uncomfortable for patients. In the case of musculoskeletal system, inflammation can lead to significant symptoms, and the pain associated is often seen as more problematic than any benefit that is being provided. In fact, in many cases, inflammation is more of an overreaction of the immune system and can actually impair healing. Because of this, it is very common to use medications to reduce inflammation in musculoskeletal issues. Steroids have a very strong anti-inflammatory effect as they directly suppress the immune system. Corticosteroids are the most commonly used steroid for musculoskeletal problems. Corticosteroids are recommended for short-term use as they suppress the immune function and with this decrease the body's ability to fight infection during use. Corticosteroids also suppress cortisol production by mimicking this hormone. Taken over a longer period of time, corticosteroids will discourage the body from producing cortisol. Once stopping the medication, the patient will experience withdrawal type symptoms until the body once again starts producing normal levels of cortisol. Because of the high risks associated with steroids, providers tend to favor non-steroidal anti-inflammatory drugs for long-term use, or NSAIDs. These drugs will reduce inflammation without suppressing the immune system. However, they are not without side effects. NSAIDs are connected with decreased blood clotting, increased risk of bleeding, and are known to lead to renal and cardiac damage with long-term use. The COX enzymes, or the COX-1 and COX-2 enzymes, are involved in the inflammatory process. NSAIDs work to inhibit these enzymes. Some focus on COX-1, such as aspirin, some on COX-2, such as arcoxia, and some work on both, such as ibuprofen and naproxen sodium. Any patient taking NSAIDs long-term needs to be clearly informed of increased risk for GI bleeds, renal impairment, and cardiac risk, as well as educated as to what to watch for if these start to develop. Cardiac risk seems to be more of an issue with COX-2 inhibitors, so providers tend to avoid these. Many patients also use topical medications to assist with pain caused by inflammation. These contain some type of analgesic, pain-relieving properties. Some examples are Bengay, Icy Hot, and capsaicin patches. Rheumatoid arthritis is an autoimmune disease within the skeletal system. Treatment focuses on suppressing the immune system. Although corticosteroids are often used for this, it is not always desirable because of the effect of cortisol levels on the body. Medications typically used for RA target the immune system but do not suppress cortisol levels. These medications work to slow down joint destruction caused by chronic inflammation, but these are not a cure. They will prevent additional damage, but they will not fix what's been done. An example of this type of medication is Rumitrex or methotrexate. As these target the immune system, they carry a high risk for secondary infections. Patients should never be started on these if they have a latent infection such as hepatitis C, HIV, or tuberculosis. Another autoimmune disease of the musculoskeletal system is myasthenia gravis. Instead of aggressive inflammation like we would see in rheumatoid arthritis, in this case, the immune system attacks the communication between the nerves and muscles, leading to poor communication and eventually leaving the muscles useless due to inability to communicate with the nervous system. Treatment is again targeted to suppress the immune system and support maintenance of these communication pathways. Cholecysteine inhibitors are commonly used to help prevent these pathways from breaking down. There is no cure, again, but treatment can reduce symptoms. The earlier treatment starts, the better the prognosis. Gout is a common condition of the skeletal system, which is characterized by the buildup of uric acid in the body, leading to inflammation in the joints. With gout, NSAIDs are often used to decrease inflammation, which treats the pain. Along with NSAID, medications such as allopurinol are used to decrease uric acid levels in the body. Colchicine is often prescribed to prevent gout attacks, as it works to prevent uric acid buildup within the joints. Patients are also advised to reduce their intake of uric acid in their diet, such as reducing their intake of alcohol, fish, caffeine, and beef.